So good morning, everyone. Today I would like to present about the healthcare management of our elephants. I will say our elephant means captive and wild elephants. I will present some cases about what we are doing. Before I started my presentation, I would like to say thank you, Asian Elephant Support, for the various support to our country and to our elephants. And that's India Trust for inviting me this webinar. And then I also thank you, the Vice President of Asian Elephant Special Inclusive, Ms. Heidi. So thank you, everyone. And in my presentations, I would like to present about the three contents, like our elephant population, and captive elephant management, and wild elephant management. Okay, this is our updated elephant population. So our elephant the population is slightly going up from 2000, I think 2019, 87 to 2014 at the moment. So the elephant population is slightly going up and down, and not difference very well. So now we have over the 3,200 captive-owned elephant. That population is a state-owned elephants, and then we also have the private elephant in our country. So the private elephant, we have some data. The private elephants long time ago. Now we don't have accurate private elephant in our departments because we stopped locking. I think in 2000, I think 2004, 2006, and 2007. So the private elephant data doesn't happen in our departments because all private elephants have to register in the forest departments. I think so now our personal communication and personal database in our country, the private elephant have about 2,500 and between the 2,000 and 2,500. So our elephant population in country and the government owned and the private owned is about 5,000 the captive elephants. So this graph show the elephant deaths, births, and training every year. The yellow color line is the population of the trained elephants. I mean, the trained elephant means we train the elephants, the baby elephant, after the 4 years old. Every year we have to train nearly 100 young elephants. And another, the line, the blue line and also the green line. A blue line is death, number of deaths, and also the green line is a birth number. So every year. So according to our recording and our data, so nearly every year the birth number is higher than the death number. That is why our elephant population is a little bit growing up year by year. So this slide is like the cause of death. The cause of death of our elephant population. So many cases, so many causes we found every year. So especially the bacterial infection and also the heat stroke and respiratory system failure, and also the poisoning case and fighting each other, and another case, and also the some parasitic infestation cases is happening in our elephant population. So according this graph, the most challenge in our young elephant population is EEHV infections. So EHV is the highest in every year, so we cannot how to say that we can treat if we found an early stage and we cannot feed in a remote area and we cannot do anything for this disease. Another higher number of the death is a generally like this is all elephants are more than 55 years and nearly the 60 years old. So every year the giant this old elephants. This is the cause of the deaths. The cause of deaths in our country within the 5 years. So EHP is also the highest number in the totally the 62 elephants deaths within the 5 years. So another the highest is general disability, mean old elephants. Old elephants dying due to the various reasons like the malnutrition and also other infectious disease. And this 2 year, and we found due to the climate change and due to the hot season, due to the very hot weather, the old elephants dying during the summer season. And it's a captive elephant management is the most problem. We found that the most problem in EHP. So EHP is happening within say 1 year and then 30 years baby elephants, infected with the EHP. In a control area, we can treat sometime, especially we cannot treat in a remote area and accessible area. Our elephant always live in the forest, in a remote area, far away from the people and the citizens. So sometimes we cannot treat that infectious disease in time. And this is another case like the dystocia. The first picture you can see the like a dystocia, but this mother is born a few months after seeing that kind of beds in the very near region. And the next one is the name is a kind old, 43 years old, the female elephant. She always how to say happening like the dystocia. The first calf also died due to the dystocia. This is the second pregnancy time, and we found a kind of the big ball underneath of the anus, and we are waiting 1 day, 2 days, and 3 days, and finally we can detect with the ultrasound and also the detection by the registry. And three day after the 3 day, the baby is not moving, and we can confirm by the ultrasound and also the palpation by the GI tract. The baby, the fetus is already dead. So finally, we decided to do the operation to remove the fetus. So this case is not the first case. We found that the kind of case in many, I think more than 5 elephants we found already, but we try to take out the dead fetus and many times, but we never succeed. After the surgeries, the elephant the mother died. So in this case, we can say that the mother. We are considered why the mother died after the surgery, and we found that the previous case and many cases, we are very late to diagnosis, to treatment. At the time, the fetus is already decomposed, seriously decomposed inside the mother, and the mother feels like this, a lot of the septicemia. At the time we do the operation, the mother dies. So this time that we can do the during a week. So that we can say this this elephant. So the operation is not very easy. We have to take a lot of time, about 9 hours. We use only the standing sedations. So, and then we have to treat every day. We have to treat every day by the local vet and taking care and treat a lot of antibiotic, a lot of dressing, and a lot of taking care. So now you can see the right picture. Now the wound is completely recover, and also mother is a good and very well in our cans. So that is one case. This is another case, the wheelchair case. And 2009, we found this elephant. This elephant also, like the dystocia case, we at the time we can take out the fetus with a lot of decompose. And today, so elephant, the mother is survived and also good condition, but a few weeks the mother's dying due to the general the septicemia. So this is the wheelchair case, one of the wheelchair case. So the mother dies after the weeks after the surgery, after the week of the surgery. So this case too is this elephant is a very important elephant, the white elephant in our royal elephant camp. So she suffered this problem more than 10 years. At the beginnings, the abnormal tissue is very small, and then year by year, a little bit grow bigger and bigger. So another problem is within the small the keratinized tissue, a lot of infection. We have to taking the dressing every day, every week. But the elephant is suffering, the not comfortable, and also the body weight is reducing, and also sometimes the loss of the appetite. We found that a lot of the problem with this elephant. So finally, we send the tissue sample to the histopathological department of the human hospital, and then they detect and they do the histopathology and detection. This is not the malignant tumor, and also not any cancer. So just keratinized, just the keratinizing Scottish epithelium, or only on skin. You can see the orifice of the urinary genital is no problem. Just this tissue is the increasing and bigger. Just the skin area. This is too big. So we can see the redness sign and abnormal walking, because the light always dropping this tissue, and elephant cannot walk. And then the elephant feel like itching and a little bit, redness, not feeding well. That is why the reduce weight day by day. So in this case, we use anesthesia like the combination xylazine and ketamine, the combination. So we can control the standing condition about 9 hours during the cutting the abnormal tissue. So we have to collaborate with the veterinary clinic in Yangon and other livestock departments, and also our MTE vets, and doing working together to remove and to treat this abnormal tissue. And we can catch and we can remove out, and we can do the ligation, and also we can control the bleeding. And so after the treatment, you can see the picture in the below. So we cannot find any abnormal tissue is growing again now. So she can feel very good, and now she is like a normal. So we cannot find any abnormal tissues are growing again. So the mass is very big, nearly I think it's one bit, the 3 by 6 kg or something like this. A really big abnormal tissue we can remove. So this is the sedation instrument of this case. We use as anesthesia and ketamine, and also we use a lot of normal line and also the local anesthesia. And for the regular treatment, we use a kind of the anti-inflammatory drug and also the painkiller and a lot of antibiotics that we treat it. And also we have to give like a kind of the topical ointments by the Mahout. So Mahout is doing it regularly under the guidance of the vet, and that is why the wound is totally completed within the six months. So now everything is normal, urination and also urination and other the behavior is all normal at the moment. So this is my topic, some case of the captive elephant management. Again, so I would like to present the wild elephant management. This picture is a wild elephant groups. I took this picture in last month in our data area, the lower part of Myanmar. So in this area, a wild elephant population is less than in our country. Wild elephant population is less than less than the 1,500. So less than the 1,500. So in this area, a lot of wild elephant also, the roaming and between like the plantation. You can see this picture. Elephant is harvesting, the moving within the plantation area. So some areas say only the bushes and also like the elephant food, so many food. So elephant is moving around that area. So in this area, we are monitoring and also taking care wild elephants from the illegal killing and also poaching human and elephant conflict by our team, the Elephant Emergency Response Unit. We call the EERU team are managing that area by collaboration with the local forest department and with the support of the Asian elephant support, like some kind of equipment. So this is one case. This is the case for the wild elephants, and last year we found mother dying nearly the people area because she got an injury and by shooting the illegal the poacher on the right side, in the right side of our right side, and you can see the arrow with the bison. So she's running out from the forest to the near the village area, and finally she fell down. And our team found at the time the elephant already dead, but we found the baby elephants near her mother. So that is why we can do kind of the rescue this baby elephant from that area. You can see at the beginning in the village, the villager is taking care, like the feeding their local food, and also the washing, and also the playing with the children during the night time or something like that. So the baby elephant is a little bit familiar with the local people, and we treat and we are waiting the elephant this baby condition, and finally the baby is fit to be transferred, and this is not very easy to transfer our rescue area, Yangon elephant, Raya elephant camp. So the first time we have at the beginning we have to carry with the total, and then we have to carry with the other light trap, and then finally she arrived at Yangon Raya elephant camp like a rescue baby. So and then you can see the poster on this picture. We made a kind of the information and the poster information for the public, because our elephant can say every day the visitors came and look at white elephant and also this orphanage elephant, so they can reach and this information about the illegal poaching and also other law enforcement and other information we can share. So we can create 3 languages like English languages and Thai languages and Myanmar languages. Because we create the Thai languages, so many Thai people can and visit our white elephant camps, and they can reach and they can support this baby elephant. Now she is very happy, and now this baby elephant is very happy and healthy in our white elephant camp and in Yangon, with the support of the Asian elephant support. Asian elephant support is already every time regularly support for the milk for this baby elephant with the donation of the those values who is working for and supporting for our elephants. And the next case is like the snare case. So we found this elephant, a male elephant, about 4 years old. It got with a snare and a lot of injury on his front legs. So our team. So because we have to capture, we have to catch with our hungry elephant, and we bring we take back to our base camp, and we treat these white elephants every day, and after this nearly 1 year, and you can see that the condition, the wound is a very good healing, and also he can walk, he can go, and finally, so we can release back to the forest after the complete wound healing. So that is one of our rescue case, and we can release back to the forest and to their group. Now our team in this area, the EIU team in this area, also the take monitoring, and also they're looking for this elephant in their group. So he is now very well. And another, so we also have some kind of the poisonous or infectious, or we cannot identify, we cannot do any identification, because we don't have a good how to say, the good organizing. Our team is only responsible for to protect and also to collaborate and to support the forest departments. When we found the dead elephants in the forest, so we have to investigate this. That is a normal death or illegal death or something like that. And then sometimes the elephant is dying like this picture, without knowing any problem because at the time we cannot send like the tissue sample and also the biological sample and also other chemical analysis, and we cannot do right time, because we have a lot of we need a lot of the facility for doing that kind of investigation. So that is why sometimes we cannot identify the elephant death due to the infectious or poisonous or any other diseases. So thank you very much And this is my presentation. And thank you very much for your attention. Sorry for my internet connection.
Thank you very much, Dr. Zaw. That was really good. There is a question here for you. Let's see. There's a question for you about the incision site for elephants in dystocia cases, and what is the prognosis?
Yes. The incision is a site is underneath of the inner area, like the perineal region, like the how to say that we have to do the incision like the vertically, and sometimes it's depend on the situation because it's a feet that is too big, and we have to make a very large incision. Sometimes we have to do the incision like the vertical and also the transverse section, or it's depend on the situation. And then our progress is the monitoring by the mahout elephant near bed or not, and then the elephants show a sign or the the bed situation. At the time, the mahouts can identify, they can investigate it, and then mahouts report to the local vet, and the local vet found some kind of the abnormal sign or relevant sign cannot cannot back normally. At the time they can report by the some we cannot propose this every time that like the lottery instrument like how to say like ultrasound or something like that, but we can prognose by the impossible readily. Yeah.
Okay, thank you. There's another question. For the 62 cases of EHV, were those confirmed by PCR or molecular technique?
Sorry, we cannot at the moment for EHV case we cannot confirm by the PCR or molecular techniques because we don't have that kind of machine. But we try we bought the only PCR machine last year with the government budget, and then we need a lot of other accessory and also the technically, and so we need that. So we cannot do any PCR techniques monitoring. We cannot confirm, but we can confirm the one case in 2030 by sending to the Dr. Arun lab. At the time, we can confirm one time.
Okay.
Yes.
So there was a follow-up question from somebody else asking if you had a surveillance program for EHV in wild elephants.
Yes, it's difficult to monitor and to do the survey of the wild elephants because what kind of sample you want to collect. For example, like the elephant feces, we can easily collect the wild elephant feces, and also we can collect some kind of the digester. So maybe the difficult for EHV surveillance in wild elephants.
Okay, thank you. One other question. Whoops, where'd it go? It just left. Let's see. Oh, somebody is asking at what dose rate is tramadol used for elephants during colic?
Sorry, in this case we don't use the tramadol. We use only the xylazine and ketamine. I showed this picture. The dosage is a xylazine is a 10% xylazine 100 milligram. We use a 0.064 milligram per kg, and the ketamine 0.021 milligram per kg. So we use that kind of only anesthesias.
Okay, thank you.
Yeah.
Are there any other questions for Dr. Zaw?
Yeah, I
think
have
there's
one.
some. Yes, please.
Yeah. So I would just like to know from the doctor that for all the postmortems that they do they have a pathologist doing it, or is it just the veterinarians doing it? And how do they confirm, especially for heat stroke? Sometimes it's very difficult to just say it's heat stroke. So just his thoughts on that.
Oh yeah, thank you very much. Your question, very good points. The postmortem we have almost systematic postmortem system. So one elephant that as soon as possible, the local vets have to go there and to investigate that elephant what is happening, and they have to investigate not only the elephant, they have to investigate the mahout and also the mahout leader and the chief mahout. So many staff there, so they have to investigate everything. So at the time, the vet can guess what happened, what kind of the problem, the elephant dead, something like that. After the doing the postmortem, we take some sample. If we think that the elephant died due to the infectious disease or other parasitic disease, we have to take a sample from the GI tract or something like this, and then we send to do the further analysis, the lab analysis. We have to send all samples to the livestock department lab in Yangon, Mandalay, and near and university. We have to send the very near lab and as soon as possible. The kind of the histo, how we can diagnose, how we can detect the histo. At the time, the vet they can investigate the weather condition and time of the death, and also the other sign and symptom. And then finally, if they suspect the elephant dying due to histo, they have to open the brain, the head, and to look for the brains, elephant brains. If they found some kind of the abnormal, like the vessel, rectal, or any blood on the brain, so by doing that way, we can identify the cause of the elephant death. Thank you.
Okay. Sometimes very difficult. Okay, thank you.
Thank you, Dr. Zaw. Are there any more questions for Dr. Zaw? If there are no more questions for Dr. Zaw, I see that there's a few questions for Dr. Yao in the chat box. Dr. Yao, are you still online?
Yes.
Okay, great. One of the questions is someone is asking if you can share basic formulation for elephant calf milk replacer in Thailand.
Or the result after the milk or elephant milk workshops, the formulas, the exactly formulas are not. We don't have any exactly formula. The formula is depend on the elephant, and we not conclude yet.
Okay.
But generally, we as the meal replacement that we use oftenly in Thai we use the human formula, goat's milk.
Goat's milk.
And for the result in the workshop, we think the formula might estimate by individual elephants, because the condition is in each individual might not same.
Okay. Dr. Zaw, what do you guys have a formula that you use for orphan calves?
Yes, Heidi. So we have many cases of orphan elephants, and many years ago. Now every often is elephant as a grown up. Now we stay using the milk formula. We use only the human milk because now we are trying to buy the big 1 kg package. 25 kg package. That is a very cheap compared with the other human milk. So this milk is only the cow milk, but we only take care, depend on the ages or the age of orphanage elephant. One orphanage elephant is very, very young. You have to reduce milk content. So and then we have to put more milk content. How to say like high concentration. We have to use a high concentration one, and the baby is very young, and then the baby is the grown up later, and we reduce the milk step by step, and then we put rice. So we combine with the milk and rice. How to say what? Rice stream, and together we feed the baby elephant. So now we didn't see any abnormal problem by providing the milk, cow milk, and rice stream to the baby elephant. Yeah.
Okay, that's interesting. Thank you.